Good day, everybody. Dr. Randy Wurts in Thrive Chiropractic. As you know, I love to get out and talk to other people in the health community, and we have a very special guest today, Dr. Jim Carlson. He's actually an integrative vet right around the corner from me, and someone who I took our dog to. So I'd like to introduce him to you as a resource because I think it's very valuable. He would be very valuable to pet owners. I can speak for dogs, but other animals as well. So Jim, welcome. I appreciate you being here. So
Thanks
Jim,
for the invitation.
Yeah, absolutely. So Jim, Dr. Jim, what got you started in this? How did you get started when you say, okay, vet, but then I want to do a little bit more of a holistic alternative care type of route and integrate that into my practice as well?
It's kind of an odd turn of events, but I worked for somebody who wanted their doctors to have a different niche.
Yeah.
So I met somebody who did some integrative things, and I said, that sounds like a good idea. So I started going that route. Of course, it didn't work out with that other doctor, so I'm by myself now. But that started the whole ball rolling.
Mm-hmm.
I started looking at homeopathy and nutritional things, and just kind of went from there. And then, do you want the story about how it evolved?
Yeah, absolutely.
So,
yeah.
I was getting ready to do a classical homeopathy class, and I met with a friend of mine who did some nutritional work with standard process, and it was actually at a meeting, and the veterinarian who actually designed the veterinary formulas for standard process was there, and we went out to lunch, and he mentioned to me, he said, if this is gonna be your first modality in integrative medicine, you might want to do something like acupuncture. He says there's a lot more science behind it, and even though homeopathy is awesome, at that point it wasn't really respected yet.
Yeah.
Which now it's a lot more respected.
Absolutely. Yeah.
So we decided to. And my buddy, who was also there, said, "Yeah, I happen to be signed up at the Chi Institute. I'm going in 3 months." So I went and talked to my wife, and she said, "You're crazy," and which we laugh about now.
Sometimes crazy works, right?
Sometimes crazy is good. And so then from there, I got trained in acupuncture, and then I went, did that for several years, and then I added chiropractics, or spinal manipulative therapy, and just kind of grew from there. I just keep looking for new things that I can add in and do.
Oh, that's neat. That's neat. Sometimes those little twists will lead us to where we call to.
And the funny thing now is when I see patients come in for integrative, I'm almost always adjusting them first before I do the acupuncture.
Okay.
Because on the first visit, I usually don't do both. It might be too much for the nervous system.
Yeah.
So I'll adjust them instead of doing acupuncture.
Okay. So you're starting to look at chiropractic a lot. It's kind of like the first line to see how we do
almost
this.
always now.
Okay.
Yeah.
So that's neat. Now, a lot of people, when they come in to talk to me, they'll come in for back pain and neck pain. Obviously, the pet or the dog owner can't say, my dog has back pain or neck pain. Okay. So what do you start seeing, or what are some cases that you start seeing with like dogs or cats in particular?
Well, actually, a lot of owners are pretty astute and can come in and say,
okay. Oh, really?
Fluffy's not moving the way she used to.
Okay.
Or you've got the obvious things where they get the arched back,
okay,
and they don't want to move and they're in pain, or they get that where they're just in a real stiff gait, and they give, I call it through the eyebrow look, where they look at you like this. They don't want to raise their head, and they're looking at you through their eyebrows, and a lot of times that's a neck issue.
Okay.
So those are the obvious ones, or a complete disc issue where they get paralyzed.
Mm-hmm.
But we also we do a lot of agility dogs where the handler might say, he's running but he's dropping some bars, and that's new.
Okay.
And we'll check with that, or your average just regular pet. It might be, she hasn't been jumping up on the bed like she used to.
Mm-hmm.
Just egregious. You might not see obvious pain. You might just see all of a sudden they're slowing down, or an activity that they used to do is now gone.
Yeah. They're just not there. Okay, well that makes
Right.
sense too.
Right.
So, and I can speak from our dog, because we took our dog to go see Dr. Jim, and he's a dachshund, and I know dachshunds, you take care of those. Those are prone to, dachshunds are prone to having their back legs go out, and you help dachshunds with that as well. Okay,
Right.
but we didn't take him in for back legs going out. He was starting to have seizures.
Yours was a little bit more unique of
Yeah.
a picture.
And he was starting to have seizures to the point where he was starting to bite and nip at imaginary flies almost, and facial tics. But I gotta tell you, when we started taking Carlson in, like the first time I started seeing a difference, a turnaround. Now, he still needed medication, but it was the turning point for him. And he started healing, and I can tell he started getting better from that point. Can you think of a couple cases where you came in, like, wow, when you first started seeing, like, this is amazing,
Yeah.
when you started validating and something you started validating?
The thing that amazes me, not necessarily one single case, but the ones that have come from a specialty clinic somewhere, and they're saying, Muffy needs surgery because we probably have a bulging disc, and they go through one or two adjustments, and they're back to normal.
Yes.
That's not obviously all the cases.
Mhm.
It's probably it's a smaller percentage, but to me that's what amazes me. Just some animals can just by just a couple adjustments go back to normal and not need surgery. I mean, obviously we have those that may still have to go to surgery.
Yeah.
That's one. And just we have a couple dogs that have say for agility have become champions. Are ranked very high.
Yeah.
We used to adjust one a French bulldog named Scribbles. He was ranked #1.
Wow.
In the country.
And agility?
Yeah.
Wow.
And it's neat that you can play a part in that and allow them to compete.
Yeah, so it's about performance. Maybe not necessarily being sick or having some ailment, but how
Right.
can we get their bodies, and how can we get their bodies to work better?
Right.
And that's great too. I love seeing those cases as well.
Yeah.
So tell me, what are some signs? You went into some signs about maybe some things that how would a person need chiropractic care for their dog or their pet? You mentioned some of those. Can you hit on those again, please?
Well, I think just for general health,
Uh-huh.
especially if I see a puppy, for the first visit, I'm almost always adjusting the puppy, just as part of the exam,
Okay.
just to get them
Neat.
started off well. But I watch for. Obviously, when I'm doing the exam, I'm feeling the spine to see how it's feeling, or looking for hot spots, or areas where I'm getting muscle twitches. So if you're feeling hot spots in the back, if you're getting a twitching, if you're petting them along the back and you don't think they're itchy and you're seeing that skin twitch, that can be a sign. And sometimes even cold spots. Some people are astute enough that if they're feeling their back, they can feel cold spots, and that might be a sign of decreased motion, decreased circulation in that area. But obviously, we'll also look for any changes if they just change their posture.
Okay.
For anything you're seeing, all of a sudden the back is looking a little bit arched where it used to be nice and flat before, or maybe they're not turning their head to one side versus both sides.
Okay.
So I'll look for things like that.
Those
Or they're holding their heads different. You might see them kind of just holding their head turned a little bit.
Like the dog who's trying to figure out where the sound's coming from.
That cute sound. Like, maybe if it's just stuck there, maybe it's not becoming cute, and you're kind of wondering something might be wrong.
Yeah, something's going on. So that's great. Now, you mentioned the nervous system, and a lot of people don't realize that as a chiropractor, I work with the nervous system, and how the nervous system really controls everything in the body. Everything in the body, and how it applies to animals as well. Okay. Can you speak to that a little bit?
Well, they're humans and animals, even though animals are on 4.
Yeah.
It's all the same. It's still based on proper motion of the spine, creating stimulating receptors that then send nervous impulses to the brain, or in other areas of the spine, or down into the organs. So it's all the same. If our spines don't work, then it's either a sign that the internal organs, there's something possibly wrong with them and they're having a reflex back to the spine, or that we may end up having issues internally.
Yeah.
And a lot of times we think of chiropractic as just being a motion thing, but eventually down the road, you can get internal issues. You probably see all the time.
Absolutely. Kids that have colic or acid reflux later turns into heartburn.
Yeah.
And indigestion later on.
And it's amazing that an adjustment in the spine can do that.
Yeah. It's like turning on the breaker box. That's what I call it.
Oh, yeah. That's great. That's great.
Yeah, turn on the breaker box. So, Dr. Jim, you have any parting words for the people that are listening? And I'm definitely going to put his information on. So, I know I've referred a couple patients, they've asked about their Shih Tzu or other animals. And I say, you might want to go around the corner here. He's right around the corner from us. Lifetime Pet Wellness. And I'll put his information on here as well when we tag it. So any parting words or what you can recommend to say, hey, this is something that we would be able to help with, or what to look for?
Well, when it comes to chiropractics, I think there's, just like with people, there's not one animal that probably won't benefit from it.
Yeah.
Just because the nervous system controls every cell in the body. If you have a blockage in that nervous system or an interruption, something's eventually is going to go wrong.
Yeah.
So I would say it's definitely a growing field. There definitely is, and for pets, there's definitely tons of research to prove that it works, and the benefits with it. And I would just, even if your pet's not necessarily showing signs or symptoms, it doesn't mean that they wouldn't benefit from it.
Good.
Yeah.
Absolutely.
Yeah, I mean,
that's why I get adjusted on a regular basis too.
Yeah. Yeah.
And I can stay healthy and keep active when I'm 90 and live life on my terms, right? Not my illness terms.
I'm gonna write that down. Make sure I check you out when you're 90.
You'll be right there with me.
Yeah.
Right there with me. I'm good. So thanks everybody for listening. Dr. Jim, thanks for stopping by. I really appreciate it. Again, I'm going to have his information as well posted. I definitely recommend take your pets in, get them checked out, because it's going to add longevity to their life, and it's going to add a lot more benefit when you can enjoy your pet a lot longer and a lot healthier and a lot better quality of life as well.
Exactly.
Yeah. Take care.
Thank you.